I'm Dmytro Gurin, Member of Parliament of Ukraine, and it's so nice to meet you all. Thank you for inviting, for like Czech Republic, for all of us being here, because you know that almost all the representative of Czech Republic, and I think that Brussels is the right place to discuss all of this, just because it's a holy land of consensus, of finding consensus and finding and collaboration. I'm MP in the healthcare committee, but I'm not a doctor. I call myself professional patient. So I have cancer, blood disease, fractures, like ADHD, episodes of clinical depression, everything that I could collect, everything collected. So here I'm speak on behalf of patients, not doctors. And today we are talking here in European Parliament about psychedelics, and a topic that was always toxic, and it was always also toxic in Ukraine. But with the beginning of full-scale invasion, the situation really dramatically changed. And you know that for the first time in 80 years, we have a major war came to the continent, and like not something like was middle-sized conflict on Balkans, for example. Yeah, it's the front line, more than thousands of kilometers. It's the big war. And Ukraine victory, it's not yet inevitable, but it's necessary. And we thank the entire European community for support all this time, from the beginning of full-scale invasion and from the beginning of the war in 2014. But winning the war is not enough. We have to win in a peaceful time, because until we didn't heal everybody we can heal, the war is not over. And let's look just at the scale of the problem. During the first 6 months after the full-scale invasion began, 500,000 people went to psychologists, psychiatrists, 500,000 people. And we are talking now only about people in Ukraine, because we don't know the statistics in Europe, and we have this huge wave of refugees. And I think that they also went to psychiatrists and psychologists. And we have now a positional war similar to the First World War. The front is more or less stable. And that means that we have a lot of PTSD. And I talked with the rehabilitation center in one of the regions, Zhytomyr, and they said that before 2014 and 2022, they had like 12 to 15% of soldiers with PTSD. That from soldiers who went to the physical rehabilitation, they had also PTSD from 12-15%, and now it's 50%. 50% of people who go to the physical rehabilitation have some symptoms of less of PTSD. And the PTSD means depression. Depression means 50% plus probability of cancer, 67% plus probability of heart disease. So we will have like a big wave, and with the consequences, because now it's not like we will see on the statistics all this suicide, we will see all these heart diseases and cancer, and we will know that it's because of PTSD, but we will have it. So how many people will be affected? We don't know exactly. Our estimates are of the Ministry of Health. It's from 3 to 4 million people will need drug support during next years. And if the war will last longer, it's more than 10% of Ukrainian population. Before the tsunami waves, they moves away from the shore. Yeah, and we are now in this position when we see the ocean, and we don't see the water, but we understand that this wave is coming. And fears tells us we cannot cope with it. It's impossible, because 3 to 4, like 10% of population, how can we do it? We're trying to remember we are Ukrainians, so we can do everything, literally. But these 3-4 million people, it's not a possibility for us. It's an obligation for us, because as I said, the war is not over until we heal everybody we can heal. That today, European Union helps us with treatment, mostly with physical rehabilitation. We thank you again for it. We don't publish numbers, like official numbers, but we are talking about thousands and thousands of patients that were treated. and had some physical rehabilitation, and it was brought back to life in the European Union countries. But we understand that rehabilitation, it's not complete without mental rehabilitation, yeah, with only physical rehabilitation. And the problem is that psychological rehabilitation, it's for Ukrainians, it's really not possible in Europe because of language, Yeah, that's a problem. And but the main thing is really different. We are not talking about thousands of people, yeah, that we can process with the help of European Union. We are talking about millions. So no healthcare system can cope with this millions of people except of Ukrainian, because we don't have any choice, and we have to find a way to cope with this problem. And we understand that we have this catastrophic challenge ahead, and such challenges, they need bold decisions, and we understand that we cannot cope it with current medical technologies. So on the 23rd of February, like day before the war, all this talk about psychedelics, I don't know, it would sound like a joke. It wasn't possible at all. But now, this summer, President Zelensky addressing the parliament, with his yearly address to the parliament, he said that we need the best and newest medical technologies to deal with this trauma for civilians and for soldiers, for army. And today we are not only talking about psychedelic therapy, but also about that Ukraine wants to become a key area for such research as Ukraine. It's aim. On this long road, we have to deal with the three issues, in Ukraine. It's legislative field, it's quantity of patients, and it's quantity of doctors. The legislative fields, all the substances that are used in psychedelic-assisted therapy are in, as we call it, list one. It's totally forbidden. And we waiting now in the parliament the final reading of the bill about medical cannabis, maybe you know. And this bill, the medical cannabis implementing in Ukraine, it's not only it changes legislative field, but it's much more change the narrative and change the paradigm of using substances at all. We think it will crack a dam in the minds of people who are sure that if we will start inpatient treatment of patients with MDMA, for example, that people will start dying next day on the dance floor from serotonin syndrome. But we know that it's not like this. In reality, we have drugs on the streets, like any country have drugs on the streets, but we don't have them where we need it. We don't have them in the hospitals. After the position of President Zelensky and after the First Lady, Elena Zelenskaya, she took under her care the whole topic of rehabilitation, and this means a lot. And after this, the politics in Ukraine, they understood that everything changed. And everything changed. So we don't need psychedelics in the streets, but we need them in the medicine. And now people starting to understand, and I'm telling them about Ministry of Health, who understand that it's just new medical technology, and then Narcopolis, who is very constructive and very, open to like medical technologies that we ask them for. And for many reasons, legislative reasons, we cannot use psychedelic treatment. Yeah, we cannot, for example, use Australia protocol of MDMA treatment. So we do, like in legal point of view, we want to start a big research. And to start such research, we need a decree from Cabinet of Minister. And we are happy because we don't need amendments to the law in the parliament, because I think that it's in the Ukrainian parliament next 10 years, it wouldn't be possible to make some amendments, because this topic is really still toxic for a lot of people. And now we have agreement on the level of between ministries, on the level of Cabinet of Ministers. With all the stakeholders, we have an agreement how police will control the whole chain, from the producing, and until consumption for medical purposes, for these research purposes. and in inpatient form. That's our deal, that it's inpatient form. It's in the hospitals, not like in the pharmacies. So and we want to start this research, and what is the good goal, the right goal of this research? The psychedelic-assisted therapy now is considered as the therapy of last hope for resistant cases, yeah. But from the point of view of quantity of patients, like 3-4 million and maybe more, and cost effectiveness, we are forced to think, to evaluate if we can use psychedelic-assisted therapy as a first line. So for naive patients, yeah, maybe it's not possible, but we have to estimate it. Is it possible? So that is what our research has to be about. And as soon as we will deal with legislative issues, we are ready to start large-scale international clinical studies of MDMA-assisted therapy to find the best clinical protocol for the group, group protocol where we need less doctors and we will have enough results. Yeah. And when we have such research, we'll provide a lot of data and justification. And it's very important that provide not only for us, because science is for everybody, and everybody will get this new clinical protocols, these results of this research. And we are looking forward not only to have this information, but to share this information. When we will have the clinical protocol, we can talk about starting the medical treatment paid by state, because now it's research and it cannot be paid by state in a situation of full-scale war. But we are looking forward to have this like a medical treatment, not just a research. But we need one more thing. We need doctors. The consequences of the USSR in Ukraine is that psychiatry is highly stigmatized, and still reminding somewhere like one flew over the cuckoo's nest. Yeah, and it's incredible, and it's a problem, and it's a tragedy for all of us. Of course, the things changed during the last 30 years of independent Ukraine, but today we have, attention, 13 trauma therapists who can work with the psychedelic-assisted therapy, 13, and we need 300. So that's another reason why we start the research first, not the treatment, to teach the specialists. And now it's being discussed where, I know that it's being discussed where to make the training center, yeah? And I think that we have to understand several things to make this decision wise, that at first, Ukrainians needs to be trained on Ukrainian cases. Torture, rape, loss of family member, loss of home, shelling, military trauma, what we really are dealing with. Even if we try to make some research in Europe with Ukrainian patient, the problem is that it's totally different circumstances that Ukrainians who live in Ukraine are in. Also, we have to remember that men in Ukraine are not allowed to exit the country. So if we make this training center outside the Ukraine, first, with only women at first. It's important. And as for me, the best place in Ukraine, if we are talking about where to make the center, is Uzhhorod. It's on the NATO border. You know, the city is bordering with NATO. It's a very special city. And I think that it's the most silent, the most safe place and city in Ukraine. And I know that Professor, that Eric, you was in Uzhhorod like several weeks ago. And so what we need, let's to the conclusion. We need the expertise, we need science collaboration, and we need funding. I think funding will not be really big because the cost of labor costs in Ukraine is low, and we can produce, our pharmaceutical business can produce substances we need for really small prices. So I don't think this funds, we need a lot of funds. I think it's will be some normal numbers. And what can we give you? We can give clinical protocols as a result of such research. We can give you the knowledge how to deploy the full-scale system on the level of state, on the level of big country, because nobody and never did it anywhere in the world. And the third thing, we can help you avoid a really unpleasant political conversation with voters on this sensitive issue, because Ukraine is like on the side. It's not yet the part of European Union, but we're looking forward to it. And it's really important to us that this becomes a collaboration and a pan-European project, because we need it to be international. But we need not only your expertise, not only your knowledge, we need to know that values of European Commonwealth of Nations are still valid. We need to know that you understand that restoration of Ukraine is not complete, is not over until the mental health of nation is restored. And we need to know that we are not alone. So thank you for your attention. Thank you for the possibility to talk to this audience. Slava Ukraini.